All right, my friends, we're going to jump back in. I swear I must say the same thing every day. Anyway, I apologize for those of you who listen to this, and just know you hit that, like, skip 15, 30 seconds, and then it actually gets to the good stuff. All right. So we were talking about, again, what I think is the most impressive part of this whole chapter, I think is the most interesting part of this chapter, is dealing with these integrative functions in the nervous system. So yesterday we talked about sleep and cognition and memory, and today we're dealing with emotion. And these emotional feelings and memories that we have are interactions between the prefrontal cortex, so the very, very front side of the cerebrum, and the diencephalon. And the prefrontal cortex is where we call it the seat of judgment. It's where you control yourself, right? If you have damage to the frontal lobe of your brain, often you are just impulsive and you just do, like, you don't think about consequences and you just do things because it's cool, like a teenager. Right? This is the part of your brain, and I'm saying this totally truthfully, this is the part of your brain that has not fully developed yet. Okay? And that's why teenagers do goofy stuff. Like smash up bathrooms, put bananas everywhere, right? Stupidness, right? Okay? We do these things. And again, this is not because, I'm not giving you an out that that's why you did it, but this impulsiveness, this inability to control those things, that comes from the prefrontal cortex, and that is still developing in you. Question? So it does override some of these pieces. You're correct. It doesn't necessarily damage this part in particular. It's more about these pleasure receptors that the drugs cause the release of those hormones that makes it feel good, like you want to do more of these pieces. So that's what builds the addiction to it. But it does certainly override that judgment that you have there. Yeah, sir. Yeah, please. So it can be, right? And this would be somebody who is criminally insane, right? That they would have some sort of brain damage that would cause them to not be able to. That's a psychopath. That's really what we're dealing with there. But for the most part, no. People just decide this is something I'm going to do,
Yeah, so, how some people they make better decisions than other people.
Yeah.
Have better judgment.
Sure.
Mm-hmm.
It could be both. It really could be. It could be that because Diana is such a solid young lady and makes such wise decisions, that her prefrontal cortex is more involved and developed than, say, someone like Josh. I'm just kidding, of course. I'm kidding. But no, it could be. It could also just be that she chooses to use that part of her brain more than some. Does that make sense? Sorry, I couldn't resist you. You're giving a hard time earlier, so. All right. The feelings. Where does the feelings come from? That deals with, in that diencephalon, the hypothalamus and the amygdala. The amygdala is that emotional center. And it receives input from different places, right? It plays a role in fear, in food intake, sexual behavior, drawing attention to the novel stimuli. And one output goes from the amygdala to the hypothalamus to produce these somatic reactions. Like when you're afraid, your heart starts going faster. Your blood pressure increases. Your hands stand on end. Or your hairs stand on end, right? You can even have vomiting, right? That comes from fear. These are reactions from the amygdala to these sensory, or these physical outputs. It also sends signals to the cortex, the prefrontal, where you learn to control those things, or where you could control them, right? I always think of a soldier. I just finished reading All's Quiet on the Western Front, this book about World War I. And this terror that these guys have during war. I mean, things are exploding and things are shooting, and yet they can still bottle that or move past that and do the function that they're supposed to be doing, right? That always impresses me. And I always wonder, could I do that? I think that we could. Right? I think that if we were in that situation, we could. But This is the part of your brain, that prefrontal cortex, that overrides those emotions to allow you to still actually do what you need to do. You realize, of course, that your behavior is shaped by learned associations, right? Between the stimuli, our response to them, and what reward or punishment that brings because of those pieces, right? If your parents are consistently on you any time that you are out of line, then you tend to be more responsive, more in line. Does that make sense? Because every time you get out of line, there's consequences to that, right? I'm not saying, that was a terrible way of putting that piece. I'm a huge fan of consistency, right? You've seen these parents, right? You've heard these parents who have told their kids, stop, 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 and the kids are just doing whatever they want, right? And then they yell, oh, if you don't stop, I'm going to blah, 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 right? And finally the kid stops. Well, shouldn't there have been some consequence for that first time you said stop, right? Okay? Because the kid just ignores you until you finally start yelling, right? So I'm a huge fan of just don't say it unless you actually mean it, right? If you want them to do something, if they don't do it, okay, well then there should be some sort of consequence, right? I'm not saying you beat them, but I'm just saying there's consequence, right? There should be some reason for me to listen. All right, sorry, got off track. Sensation, yes?
Back to memory real quick.
Yes.
Have they done like tests on elephants to see why they have the memory?
Good question. I don't know that one. I don't know.
Because they could compare and then see how much.
Could be. Could be, yes.
Like, we could have counted 3, and then by the time you got to 2, they got a consequence because we got to 2.
Nice.
We'll count to 3. You know, if I didn't do it by 2, then we're like, I should have counted.
I got you. Oh. I did not ever use that strategy, no, but I see the benefit to that. In other words, don't wait till the very end. Take care of it now. I'm not opposed. There's some solid reasoning there. Okay, so sensation is our next of these integrative functions. This diagram is something I referenced to you in your study guide. I'm not saying I want you to memorize this by any means, but this is an important piece. This is something in the past I have had students memorize, but we'd had much less information than what we're dealing with here. But what this does, it basically just gives you a map of what areas, and again, that caveat again, that it's not one specific area that's the same in every single person. It's spread out. But in general, these are the areas that cover specific sensory pieces, right? Your primary motor cortex is this prefrontal gyrus, and your primary sensory cortex is this postcentral gyrus. You have motor association areas, the Broca's and the Wernicke's area. We'll talk more about these in a moment. Your olfactory, your smell, your auditory, your hearing, your visual cortexes in the back. So parts of your brain are more specific for certain things. But again, it's not like they're not colored different things in your brain and you can say, oh, look, right here is where it is. No, it is kind of spread out a bit. So let's talk about these different senses, because we talk about them briefly in your study guide. For vision, we're dealing with occipital lobe, right? The primary visual cortex is in the occipital lobe. You do have other pieces that move other places, but for the most part, we're dealing with that occipital lobe for vision. For hearing, the primary auditory cortex is in the temporal lobe, as well as down into the insula. And you also have areas that deal with recognizing words or a familiar piece of music or a voice on the phone. So taking voices out of context or in different situations and still being able to understand them. Equilibrium, which is your balance, right? That is a huge portion that deals from the cerebellum as well as into those brainstem nuclei. And that helps you with head and eye movements. Because you know your eyes play a huge role in vision, right? Like if you're standing, did I say that? In equilibrium, thank you. Your eyes play a huge role in equilibrium, thank you. But if I'm standing on one leg with my eyes open, it's fairly straightforward. If I close my eyes, it's more difficult, right? Vision plays a huge role in balance. Sure, right, because then you're kind of giving yourself an anchor, yeah. So there's a huge component to your ears, you're correct. we'll talk in great detail about the structures that do that piece. And you have a dynamic balance, you have a static balance. Yes, so ears are a huge piece, but vision also plays a role in that. Taste and smell, gustatory, that's what we call taste. The gustatory complex, that is in the parietal lobe on the side of your brain here. And your olfactory, your smelling, is in the temporal lobe and the frontal lobe, the inferior surfaces of the frontal lobe and the temporal lobe, which makes sense. That's where the nerves are that come in for these guys. And by the way, I'll go back to those special senses just for a second. We have a whole chapter that's on the special senses, about how you see and how you smell and how you taste. So much more detail coming there. This is just the parts of the brain that are involved in that. So our primary somatosensory, so this is just our general senses, right? Touch, pressure, stretching, movement, heat, cold, pain. These general senses, not special senses like taste and smell. These are covered in one very specific area in the brain. That post-central gyrus of the parietal lobe. General is just meaning, so by special we're talking about a specific sense. Again, like the sense of smell, your tasting, your vision, your hearing, your balance. These are what we call the special senses. General means because over our body we have these senses. Right? The touching, the hot and cold, the pain. Does that make sense? So, in this post-central gyrus, I think this is one of the coolest things you see. So here's post-central, right? Anterior, posterior. So this darker purple is the post-central gyrus. Because remember, this is called the central sulcus that runs here, that divides the frontal and the parietal lobes. This is what we call a homunculus, this picture here. And where is this in your textbook? So you can see it closer. Page 535. And you look at that, and it's showing you a body that's kind of stretched out and distorted. Right? And I get your question, I promise. Oh, you're just stretching. What they're showing you is this is the portion of that post-central gyrus that deals with the sensation of those specific body parts. So can you see that there is a large amount of space in your brain that deals with the sensation of your tongue? That's why your tongue is so large. Okay? So again, the pictures are distorted, that the bigger the picture is, the bigger that object is, the more part of that post-central gyrus that works toward that area. So for example, your tongue has a ton of sensory receptors. Why do babies put things in their mouth? They're actually literally feeling it. But it's more developed in their mouth than it is in their hands. Your hands up here, look how big the hand is compared to the rest of the body. Because there are tons of sensory inputs in your fingers. So we need a large area of the brain to deal with those. Versus your back or your buttocks, there's very little sensory input there. Right? You don't need it. Because I'm not going to come up and say, I can't tell if this is a book or I'm going to use my rear end. It doesn't work. Right? You use your hand. It's not nearly as sensitive. Does this make sense? Question? Why what? That's just how it is in the brain. It's moving from lateral to medial. Like here is the longitudinal fissure right here, right? And then moving around toward the other side. So it's just how it is located in the brain itself. Are you with me? Again, I just think that's pretty cool to see these very specific areas. Notice the feet. There's actually quite a lot of input in the feet. Have you seen these folks who have like lost their arms, but then they can use their feet to like draw and pick up things, and the feet are almost like second hands to them. They don't work as good, but there's a lot of sensation we have in our feet, and we just keep them, covered up in shoes all day long. Motor control works the same way. The motor control, instead of being post-central gyrus, we have the pre-central gyrus. And that is what deals with all of the motor control. Again, somatic motor control, things we can think of consciously and control, comes from, that prefrontal gyrus. They're showing you pictures here of where those guys are. And here's the homunculus 4 motor piece. And notice it's different. If you look there, so 534 was the sensory, 535 is the motor. There are some places that were included in the sensory that are not included in the motor, right? There's a whole visceral sensory section of the brain. There's a whole genitalia section of the brain in the sensory area, but not in the motor, because we can't consciously control the churning of our stomach, right? We don't consciously control movements in the genitalia. So you get a much larger, see, look how humongous the hand and the arm is, right? Huge control, very fine motor control in the fingers. And the feet too, quite a bit there. In your face, look how humongous the face is stretched out. Because you can do so many different things. You can control so many different pieces of your face. The tongue is an impressive thing as well. A lot of movement that goes along with that tongue to produce the words that we have, to chew the food that we have, right? So again, that has just always interested me. I always thought that was a pretty cool something. Making sure that I don't have anything else. You do have the basal nuclei and the cerebellum that also play important roles in the control of muscular contraction. So think of that post-central gyrus sending the signal that we need to contract, right? And then the cerebellum and the basal nuclei kind of smoothing it out or giving the directions, or maybe it's like your dad tells you, oh, you have to go do something. And then your mom kind of says, well, okay, why don't you do this and this and this, right? And kind of gives you the more direction, more smoothness piece. That's what the cerebellum does. Lisps can be caused by brain difficulty. It can also just be a structural piece with the tongue and the control of that. It just depends. Yeah, there's a whole wide variety. And there's even categories of lisps based upon what letters they're lisping or how they lisp. There's a whole branch of medicine, again, a speech pathologist that deals with these specific difficulties in talking. Yeah, it's very cool. Right, so they give you much more detail. I just gave you a blanket statement about basal nuclei and cerebellum, but they give you much more detail here. That the basal nuclei are helping you to control your start and stopping of motions, the repetitive motions like in walking, or if I'm doing things like typing or writing, that you have this highly practiced skill. That's the basal nuclei that are dealing with that. The cerebellum, again, it's about the control, maintaining muscle posture, smoothing and coordinating. That's the role that the cerebellum plays. Language is our next one. We're rolling well here. Language. Of course, language is our ability to read, to write, to speak, to understand words. And you've got two big areas in your brain that deal with this. The first is called the Wernicke's area, and the second is called the Broca's area. So the Wernicke's, it permits recognition of spoken and written languages. So when we intend to speak, the Wernicke area formulates those phrases, and then it transmits that plan of what you're going to say to the Broca. So the Wernicke is the sensory for speech. Are you with me? Whereas the Broca is the motor for speech. This is what actually generates the muscle program, the actual motor control for your mouth to move like this, for your tongue to move like this. Right? It's like Sebastian from The Little Mermaid, right? That's what it makes me think of. Right? It's an old reference. Look it up. Look it up. Look it up. And if you have strokes, if a stroke occurs in this part of your brain, you can lose the ability to understand speech. That would be Wernicke's, like you couldn't recognize this certain language or pattern. You could speak, maybe, or you could write, but you couldn't actually do this. Whereas the Broca, you could actually understand it, but you couldn't actually speak. Does that make sense?
So then for people who either come out of a coma or something and they can understand a different language that they weren't able to before, is that something that happens with
I don't know the answer to that one, but I don't know. I don't know what would be the... I would imagine it would have something to do with one of these areas, or this primary auditory cortex down here where you're kind of dealing with in the temporal lobe, but I'm not positive. Yeah, I don't know. It's a good question. Aphasia is what we're... Oh, sorry. Go ahead. Shh. Maybe. And just unconsciously not knowing. Yeah, I got you. Aphasia is a language deficit. Well, this is what we were just talking about, fluent versus non-fluent aphasia. Again, in the Broca's is affected, slow speech, difficulty choosing words, using words that only approximate the correct word, whereas Wernicke's, the speech is normal and excessive. They just use senseless jargon, can't comprehend the written and spoken pieces. Some fascinating pieces. I've worked with patients when I was a physical therapist who dealt with these aphasia issues. Just heartbreaking. You know, they want to talk. You can tell they're trying to get the words out. They just can't say it. My dad, who's going through Parkinson's, this is how we first noticed him. He just could not come up with a word. He's trying to tell you a story, and I just can't get out what it is. You know? Lateralization. We're doing good. We're doing good here. Cerebral lateralization. And the point behind this is that the two hemispheres, neither of them is dominant. Have you heard this before, that, oh, I'm right-brained or oh, I'm left-brained? There is no dominance as far as both spheres are working together. Both spheres are doing activities together. But there is some specialization in the two sides. Okay? The left hemisphere is what we call the categorical hemisphere. So that specializes in spoken and written languages, sequential and analytical reasoning, like doing math and science pieces, breaking information into fragments and analyzing it. Whereas the right hemisphere is usually what they call the representational hemisphere. So it perceives information in a more integrated way. It's the seat of imagination and insight. Musical and artistic skill come from that side. Perception of patterns and spatial relationships, comparison of sight, sound, smells, and tastes. So you've kind of got these two different types of hemispheres, the categorical and the representational, but the categorical is not always the left hemisphere, right? Because that would be what most people would say, I'm left-brained if I'm good at math and science and analyzing things, right? But it's not always the left side of the brain, right? It does, however, correlate to whether you are right-handed. If I am right-handed dominated, if I'm right-hand dominant, then 96% of the time, my left hemisphere is my categorical hemisphere. This analyzing, this math and science kind of piece, right? Whereas the right hemisphere for right-handed people are only dominant, are only categorical in 4%. Are you with me? Okay? If I'm right-handed, then my left hemisphere is usually the categorical one. Usually. For left-handed folks, the left hemisphere then becomes the the right hemisphere becomes the categorical one. It's these pieces here, right? The categorical is the analytical and sequential and breaking things into fragments, versus the representational one is the imagination, insight, perception of patterns, that kind of piece. Sorry, lots of questions. Yes?
What if someone is ambidextrous?
So it can be that that was kind of spread between. Yeah, it would just be kind of spread between. Yeah. Nothing wrong with that at all. Was that what all you guys were going to ask? Wow, that's impressive. That's a good question. That would be about your 15% where neither are specialized. The pieces are just in both sides. Sir? Shh. Sure. Right, so that goes into this. Thank you for making that transition for me, Casey. That kids, especially, they can, if some damage occurs to one side of the brain, they are very plastic, meaning that they can take and move those things. Instead of being controlled on the left side, it moves over to the right side, and now we still can control and do the pieces that we want to do. Adults are much less resilient as far as that goes. If a damage like that were to happen to an adult, you would more than likely just lose those kind of pieces. Whereas in a child, the brain is still developing and functioning in a way that it can take over in this other leftover piece. I don't. I would imagine teenage area. I would say, late teens, mid to late teens. Right, get it now, exactly. Yes.
Is that why people can train themselves to become right-handed?
Sure, just like any other skill, yes, you can learn to write with your left hand if you are right-handed. Absolutely. You don't have to be left-brained or right-brained to do that. No, absolutely. Or let's say you break your arm, right? I'm in a cast. Now I have to write with this non-dominant. It happens all the time. Now, it all depends on what part. We're talking about cerebral pieces here. So not dealing with the stuff that's keeping the heart beating or the breathing and these kind of pieces. But what they're saying is if there is damage to one side, if the kid is young enough, some of that function can be spared on the other side. It basically just kind of takes over. Not necessarily extra space, but it can just utilize the space that it still has to do these important functions. Yeah, this whole thought of like we only use 2% of our brain, yeah, it's trash. It comes from a study way, like 100 years ago. That's not true. Yeah, no. No. Good. Okay, we've got 6 minutes, guys. Shh. And the opportunity to actually be able to finish this makes me happy, because I was worried that I want to give you time to do dissecting on Monday. I was afraid we're going to have to do a bunch of conversation. But we'll still spend some time on these cranial nerves. I want to point out to you on the bottom there of your study guide, what I'm looking for you to do cranial nerve-wise is pretty straightforward. There are 12 different ones of them. I'm pausing. So there are 12 different nerves. You should know their names. You should know their numbers. Okay? Because the numbers are important. They get used consistently. This is cranial nerve number 7. Oh, that's facial nerve. Okay? And then the functions I want you to know are just what I've listed there for you on your study guide. Okay? Please understand, and it pains me, because your textbook does such a good job with these cranial nerves. It starts there on page 539, and they give you detailed information about all 12 of these nerves, all the way through page 548. So almost 10 pages worth of solid detail. And this is what controls basically all the movements of our face. There's a lot of detail here. We just don't have time to go through all those pieces. So we will spend some time at the end of class on Monday talking about the cranial nerves. But I want to just mention them briefly. If you look online, there are tons of mnemonics for the cranial nerves, because this is one of those classic things that every A&P student has to learn. right? Your textbook even has one that they used. And I've never heard this one before, but I'll put it up here for you. It is old, opie, occasionally tries trigonometry, and feels very gloomy, vague, and hypoactive. And what I kind of like about this one is that the first pieces of the words actually mimic the first pieces of the nerves, which I thought is pretty decent. Okay? That the first of our cranial nerves is the olfactory, old, right? The optic, opie, the oculomotor, occasionally, tries, the trigeminal, trochlear, and trigeminal, and is abducens, feels is facial, vestibulocochlear is very, the glossopharyngeal, gloomy, the vague, which is almost exactly vagus, and for accessory, and hypoglossal for hypoactive. I thought it was a decent mnemonic. I've seen much worse than this. The one that I had to learn way back in the day was on old Olympus's towering top, a Finn and German viewed all hops. And that just gave you the first letter of each piece, and you had to then translate that. Okay? On old Olympus's towering top, a Finn and German viewed all hops. Right? But the thing is, they changed one of them. They changed. This vestibular cochlear nerve, which is right here, the vestibular cochlear used to be called the auditory. That's how I learned it, was as the auditory nerve. But then they say, no, it's not just auditory. It's not just hearing. It's also vestibular. It's also balance. This one nerve goes to both of those centers in your ear. So they changed the name. So that kind of threw off the mnemonic. Okay? There are mnemonics that tell you whether they are motor or sensory or both, because that's another big thing that folks learned. Okay? Because some of these cranial nerves are purely motor, some are purely sensory, some are mixed. They're both of them together. Your textbook does mention that, well, really, all of them are really mixed. There's a little bit of motor and sensory in all of these nerves. So they don't even really discuss that piece much at all. But that's an old piece we used to always do. So again, this would be an easy multiple choice question, right? That what nerve is it that does motor for vision? That would be oculomotor. What does sensory for smell? It would be olfactory. Does this make sense? Okay. We did it. We even finished on time, which I'm pleased with. So again, Monday, come prepared on time. Can I beg you? On time, so that we can have time to work through our dissection of the brain and then have a little bit of time to talk about cranial nerves. Adios.